Okay, so in here we'll be looking at the therapeutic application of anticholinesterase drugs, right? And anticholinesterase drugs are basically any drug that is against cholinesterase. And what is cholinesterase? Cholinesterase is that enzyme that will degrade acetylcholine at the neuromuscular junction. Okay, you know the acetylcholine is needed for proper functioning of the muscles, right? So if there is an enzyme that is eating this acetylcholine up, then acetylcholine will not be available to the muscles, all right? And this can result in several medical conditions, which we'll be looking at, all right? So now these medical conditions result as a result of this enzyme, okay? So if you have some drugs that can actually fight this enzyme, then the drugs will actually get what cure that medical condition. Do you understand? So let's look at the various medical conditions that we can use the anticholinesterase drugs to actually improve or manage them. Okay, so you can see this is what acetylcholine. Acetylcholine will be released from the postsynaptic nerve to the presynaptic nerve, right? And it needs these receptors, okay, receptors. Now we can have some enzymes within this space, which are the anticholinesterase, right, eating up this acetylcholine, not allowing this acetylcholine to go to the what presynaptic presynaptic nerve. Okay. Now we said that therapeutic applications of anticholinesterase drugs or any substance that will uh, fight the cholinesterase enzyme, we can use it in the treatment of glaucoma. And this is glaucoma, right? You can see glaucoma here. See this whitish stuff in your eye, okay? And glaucoma can come as a result of acetylcholine not being inadequate amount in the body, all right? So, and this could be as a result of the enzyme acetylcholinesterase eating up acetylcholine. It can also be used in treating drugs like what myasthenia gravis. This is myasthenia gravis. Myasthenia gravis is basically muscle weakness. You see the drooping on the side of the cheek, all right? Drooping on that side of the cheek, all right? It can be used to actually treat this medical condition. Then also it can be used to what? Drugs, anticholinesterase drugs can be used to stimulate the gastrointestinal tract, urinary tract motility, all right? For examples of these anticholinesterase drugs include what? Neostigmine, okay? They have the same effect as agonists. They have the same effect as drugs that are promoting the actions of acetylcholine, okay? Because they are indirectly promoting the actions of acetylcholine because they are fighting what is fighting acetylcholine, thereby allowing acetylcholine to what? Act. Do you understand? So these drugs, they act the same way as what? Acetylcholine agonists. Then also, they can be used for what? Reversal of neuromuscular blockers. So sometimes in a surgery situation, you actually need like some muscle relaxant, okay? So that they can block receptors on the muscle so that it will now relax the patient so that it can carry out this surgery, okay? But after you are done, if you want to reverse this block, then you have to use what? Anticholinesterase drugs, okay? Then in atropine poisoning too, these drugs can be used, all right? So that's basically some examples of the therapeutic applications of anticholinesterase. If I find more, I'll put it in the description of this video, right? So see you guys pretty soon.